All right, I'm going to go ahead and begin because we do have a quite lengthy agenda. Before I get started with the presentation in proper, just a few housekeeping items to discuss. All lines are muted just to avoid any feedback or background noise while I'm walking through the presentation, but we do have a chat box. And I will periodically stop as we go through the different sections. And there's a natural breaking point to answer any of those, as well as if we have some time at the end, I will answer them. If time doesn't allow, we will be sure to answer your question offline via email. So feel free to drop those questions in that chat box whenever they strike you. We are recording today's session. We did record the session that we did on Tuesday as well, and we will send the recording link to all the individuals who were able to attend today, and include the slide deck as well as the HSCRC Year 5 MPA memo, so you can reference that. We will publish this on our website as well. The report has been released this morning. So those of you who have gone into the CRS portal this morning should have seen this new tile if you had access to the Year 4 MPA reports. We will cover how to get access and where to find the report in a second. So if those of you who couldn't locate it, we will cover that. All right, with that, I will walk us through the agenda for today. We're going to cover a few background kind of items to keep in mind when navigating these reports. And we will show you what the reports look like and where to access them on the CRIS Reporting Services portal. Then we will do kind of a very brief overview of the reports, just so you can understand what we're talking about visually. Then we will spend a decent amount of time on the changes that were made from Year 4 to Year 5, so you have a clear picture of what specifically has changed if you were a user of these reports in the past, so you can understand what they look like now. Then we will do a very detailed walkthrough of the report, especially the sandboxes, as those two are the reports where you actually have a lot of flexibility to do filtering and things of that nature. Most of the notes and documentation I included in this PowerPoint for reference, but we'll talk to as we go through the specific report walkthrough. So we will kind of speed through that section, but it's a great kind of compilation of things to keep in mind as you're using the report. I'll also note the user guide for this report is very helpful, as it contains a lot of detailed information about how metrics were pulled from the CCLF data and how certain filters interact with other filters. So I definitely recommend, if you're not familiar with the sandboxes and you're trying to leverage them for some analysis, the user guide is a great place to have handy while you're accessing and using these reports. And then lastly, we will talk through two additional reports very briefly on how they can also be used and leveraged to support understanding your MPA attributed population. So with that, I will take us to our background section. Kind of a quick disclaimer about this presentation. These webinars are not intended to cover the complete Medicare performance adjustment policy, but rather give an overview of the reports available in the CRIS Reporting Services portal to understand performance under the MPA policy. If you're curious about the MPA policy in detail, I would visit the HSCRC Total Cost of Care webpage, as well as referring to the memo that I will include in the email to the attendees after this session. With that said, I will talk about one piece of policy change that impacts the reports greatly, and that is the year 5 attribution algorithm change. So the MPA attribution shifted from a multi-step algorithm to an only geographic approach, with an additional layer for academical medical centers for this calendar year 2022. The academic medical centers layer use an alternative attribution approach where beneficiaries with a case mix index of greater than 1.5 who receive services from the academic medical center are attributed to that academic medical center, as well as the hospital under a standard attribution geographic approach. AMCs will also have a geographic base attribution. And case mix index, for those of you who aren't familiar with that terminology, is just a gauge of comparative cost needed to treat a patient group in a hospital within a calendar year. For reference, an index of 1 indicates that its cost, the national average amount of resources per patient to treat the hospital-specific patient group. So under this new model, beneficiaries and their costs are assigned to the hospital based on residency of the beneficiary. Zip codes are assigned to hospitals based on the hospital primary service area, or PSA, listed under the hospital's global budget revenue GBR agreements. So last little recap here on the left side of the screen, you can see what the attribution approach was in the past. So beneficiaries were attributed to providers who then linked up to the hospital in some capacity, and then there was a geographic kind of catch-all there at the bottom to scoop up any beneficiaries who were not attributed under another tier. But now on the right side of the screen, you can see what the new year 5 attribution model is. It's purely geographic for every hospital, unless you're an academic medical center, and then you have that additional layer of beneficiaries attributed to you. All right, so with that policy background out of the way, I will talk about where to access these reports. So the MPA monitoring reports can be found on the CRISP Reporting Services portal at reports.crisphealth.org. And you want to make sure when you log in, you're using your username, password, and then doing two-factor authentication to actually join into the portal. Once you're in the portal, the monitoring reports for MPA can be found under the Medicare population tab. As shown on the screen, you would click that and then scroll down to the MPA Monitoring Reports Year 5 report. Those years after the kind of the report title indicate the performance year and base year of that policy year. So for year 5, the performance data is calendar year 22 and the base year is 2019. So report release, like I mentioned at the very beginning, the reports were actually launched this morning. So all active hospital users with access to the year 4 MPA reports will automatically gain access to the year 5 reports. If you do not have access to year 4 or you don't see year 5, as of this morning, please reach out to your CRS point of contact. If you do not know who that is, contact support@crisphealth.org and we will direct you to the right person who can enable your access. And then the last note there is just these reports are intended for hospital users only. All right, so that covers our background section. And then I am going to move now into a brief overview of the MPA reports, just so you see them visually. And then we'll circle back after the changes to do a detailed walkthrough of the actual reports. This is a good place to remind folks, if you have questions, please drop them in the chat and we'll stop as we go through each section to answer those. So visually, there are 3 dashboards now in the report. You're familiar with these from if you used the MPA reports in the past. We did eliminate kind of 2 additional reports that we used to have, as those were really used to understand beneficiary attribution under a tier-based approach, and now using a geographic only approach, it doesn't really make sense to persist those dashboards. So you'll see in a minute, we consolidate a lot of those dashboards into the MPA monitoring reports, which is indicated as the 3rd kind of piece there. The other 2 dashboards that you have access to that are the same as the past are the all hospital sandbox and the hospital attributed sandbox. So the hospital sandbox is really a interactive query tool which enables hospitals to kind of use the many different filters that we have across all beneficiaries, and is just the only thing that's not there is a few restricted categories, which I'll detail in later slides. If you are curious about just your hospital beneficiary attribution, the hospital attributed sandbox is the place for you to leverage the same functionality of the all hospital sandbox, but is just limited already to the hospitals that you have access to and the beneficiaries attributed to those hospitals. This dashboard contains all of the flexible filters and categories that we have available at your disposal. And then lastly, the MPA monitoring reports contain fixed views of key analytics. So to continue on with that, here's some more details about those reports. So component 1 and 2 are our sandboxes, or interactive query tools. They allow for flexible interfaces that allow power users to create custom aggregate reports on multiple beneficiaries and claims. Really, the intention of these dashboards is to support kind of benchmarking across facilities. I like to think of them as kind of complex sandbox tools that allow users to slice and dice the data the way they like to support additional analytics. And then again, they're split between the all hospital and the hospital attributed sandbox. So the main difference between the two is obviously the hospital attributed sandbox is limited to the hospitals that you have access to and the beneficiaries attributed to those hospitals, but also includes regulated and unregulated providers as options to kind of categorize your filter and your query, as well as professional provider. And now it also includes MDPCP supplemental adjustment facility affiliated to the beneficiary as a filter. The last component of the MPA monitoring reports are the monitoring reports themselves. I like to think of these as summary level status checks and really kind of give you all of the financial numbers that you would be interested in to view your performance under the MPA policy. One last note here on the slide is when I say hospital in this presentation, I'm really referring to the attributed beneficiaries of that hospital under the MPA attribution. I'm not talking about a hospital in terms of delivering care within the 4 walls of the hospital. So that's just something to keep in mind as I say hospital. I'm really talking about attributed beneficiaries. If I do mean hospital in the kind of delivering care sense, I will specifically call that out. So that is a brief overview of the reports. Now we're going to talk a little bit about the data that is in the report themselves. So all of the MPA monitoring reports are fed by the claim and claim line feed, or CCLF data. This data contains files that are set of Medicare claims that include Medicare Part A and B claims from inpatient, outpatient, SNF, home health agency, hospital, professional, durable medical equipment, and prescription drug services. These files contain claim level detail, including Medicare payment amounts, diagnoses, procedures, data service, provider identifiers, and beneficiary copay amounts. These data sets were included for the MPA monitoring report, as they tie very closely to the CCW in aggregate. After many analyses performed by the HSCRC, we could kind of see that that is the case. Patient level detail is available in the MAID and DEX report, and I'll cover that at the very end when we talk about additional reports to support understanding your MPA population. And the last note about the CCLF claims is SAMHSA claims are not included in this data set. All right, so now you have a background of the data feeding the reports. We will talk about some of the nuances with reporting periods and data refresh. So for year 5, as I already mentioned, the attribution is based off of 2022 data. This is the PSA with the beneficiary resident information as of January 22 and 30-day academic medical center episodes that feed into the attribution of beneficiaries under the geographic model. So the reports that were just released today include the complete base year of 2019, as well as claims paid through January 2022. This is important to keep in note as you use these reports today. Some of the MPA monitoring kind of summary level reports kind of look a little interesting because some of the columns were kind of built to show changes over different quarters. So everything that's performance year will look the same because we only have that 1 month of performance data available. So how the reports get updated with data, we refresh our reports monthly with new CCLF claims. Incurred months added will be added on the 5th month. So for example, February 22 data will be released next month because that includes 3 months of run out plus 1 month for us to get the data from CMS. And we kind of do it that way, 3 months kind of run out so that all of the claims from that month are complete and kind of considered mostly final at that point. So we feel good about providing hospitals kind of insight into the analysis, as they won't be changing as much as they would if we just released the reports as soon as that data month was available. So brief summary, 3 months of run out are required for us to add data to these reports. And they follow that kind of cadence of what we kind of have set now. So January claims are available now, and February will be available next month, and so on. All right, so that is a brief overview of the reports themselves and the background knowledge needed to understand these reports. Now I'm going to highlight some of the major changes that we've made from year 4 to year 5 in these dashboards. So you clearly understand the exact things that will change if you're used to the year 4 or year 3 reports. So the 4 major changes are the following. We streamlined the MPA monitoring reports and we consolidated the specialized drill down and eliminated those tabs for users. Next, the claim amounts were changed to MPA-Neutralized payment amounts. I don't know if folks will kind of be able to visually see that, but in the background, this is what had occurred. I've already mentioned the MPA supplemental adjustment affiliated facility category is now available in the hospital attributed dashboard. This is a category that's not available in the all hospital dashboard, but is specific to the hospital attributed sandbox. And then lastly, we have updated the reward penalty calculator to reflect the geographic attribution approach. And then next month, we will also add for the academic medical centers a tab for them to review performance under that additional attribution tier, as well as a tab to see the net between the geographic and then the additional AMC layer. So to go into detail about those changes specifically, the MPA monitoring reports, these have been consolidated, and we will touch on them once we get into the overview section, and the specialized drill throughs have been removed. And the reason, like I've already alluded to, is because these reports are really utilized primarily to understand tier-based attribution and not really applicable to geographic and academic medical center approaches. All of these reports are still available through the same links on the CRS landing page. Next, we have our MPA-neutralized payment amounts. So payments in CCLF claims include hospital-specific MPA adjustments for the prior performance year. So 2022 performance is reflected in the 2022 claims. This enables total cost of care performance to be evaluated on unadjusted Medicare payments. And 2022 claim dollars are adjusted in all CCLF reports to remove the hospital-specific MPA adjustments for performance year 2022. So 2019 and 2021 claims are not neutralized. The next change that we made is adding the MDPCP affiliated facility category to the hospital attributed sandbox. So you'll see this as a filterable option in the category section. And this allows for tracking of utilization and trends for beneficiaries attributed under the MDPCP supplemental MPA adjustment. And these attributions are based off of the providers that hospitals submitted under the affiliated providers tab in the MAT tool. And this allows the hospitals to evaluate the overlap of beneficiaries from the geographic attribution MPA approach and the MDPCP supplemental MPA adjustment policy. The last major change that we made to these dashboards was to the reward penalty calculator. So not only has the reward penalty calculator been updated to support the geographic approach, but in the July release, not what was released today, but what will be updated next month, will include the academic attribution tabs. So essentially you'll have 3 tabs to support understanding of reward penalty. Under the MPA policy, you'll have your geographic approach, you'll have AMC approach, and then you'll have the net, which combines both of those calculators to calculate total annualized reward penalty amounts. So those are the major changes that we made to the performance report. Now I will actually go through in detail the tabs available under the MPA Year 5 monitoring reports. All right, so this slide looks a little complicated, but the reason I set it up this way is so that you can visually follow along as I go through the different report components available to you under the sandbox. This is showing the all hospital sandbox, but the hospital attributed sandbox looks exactly the same. The only difference there is what I kind of already stated, in that hospital attributed sandbox is already kind of pre-filtered on the back end to only allow data from attributed beneficiaries to the hospitals that you have access to. And I'd recommend using that one if you only care about the hospitals that you have access to and the MPA attributed population to those hospitals. The All Hospital Sandbox is really there for you to leverage all beneficiaries and kind of support other total cost of care queries that you want to run from the data set that we have available. So this dashboard is a Tableau dashboard, which allows users to analyze Medicare utilization and cost and total. And like I mentioned, users will have access to all of the Maryland data in this report, with the exclusion of some of those fields that we've already discussed. And so going through the report components, on the first component there is the report selector. This allows you to switch between the available modules in the MPA monitoring reports. So for example, you could go from this All Hospital Sandbox to the summarized MPA monitoring reports very easily, just clicking that slider. You can also click that slider back if you are working in the dashboard and you want to maximize the page space that you have. The second report component there is the pause play button. And this really, if you're using the sandbox, is your best friend. As if you do not have the pause button set, any filtering that you do in the report will cause the report to query the database, which will result in a few seconds of load time. So I recommend hitting pause if you're doing a complex query with multiple options selected. The third component here is the Excel button, which is available across all of our MPA reports, that allows you to export the current query that you have set down into Excel. And I recommend that you kind of manually label this download as the column headers and the query that you kind of made in terms of selections won't be populated on the workbook. So it's important, if you are doing multiple downloads, to remember which query you had set for the data exported. The fourth component here is our kind of our time controls. So the first one is the date control. And this, you can really think of what sets the data that is available to query in this sandbox. So the incurred through, start, and end sliders establish the time period of data displayed in the report. All data is assigned to the incurred month. So selecting a day in the slider won't actually change any of the results that you yield. This is because reporting is not available on an individual day, and we assign all of the data to a month period. It's just one of the kind of legacy features of using a Tableau dashboard. The fifth component that is also under time control kind of category is the year dropdown. So unlike the date control filter, this year period will actually control the kind of time windows that you see within the query, while the date control controls the data that is available to query in the report. So it's important to have that kind of distinction in mind. The year period can be changed to reflect calendar years. You can also use this filter to select fiscal years. You can choose rolling periods, which will define 12-month periods, with the last one ending through the last incurred end date slider. And then you also have year to date, which will provide performance reflected with the latest month available of incurred through in the report. The next report component that you have available to you is the time window. So this will kind of control the segment of period that you have defined. You can choose in this selector annual, quarterly, and monthly. With the fifth component and sixth component of this report, the year period and the time window, There are some interactions when you have certain ones kind of displayed. For example, if you have calendar year set in the year period and then you have quarterly set, there will be a certain way that the report will be displayed compared to if you have the quarterly set and you had fiscal years, for example. So this is a section while you're using it where I would reference the user guide because it details all of those interactions between the filters of 5 and 6 in the year period and time window. So you can really understand exactly what you're querying as you're using this. Then our 7th element there is the MPA facility assigned. This limits the report to 1 or more MPA assigned facilities. Then if this filter is select, the report will only display results for the beneficiaries attributed to that facility. If the report is limited to 1 facility, using this field to select the facility first will actually improve the response time as it cuts down the data set that is available to query to just the beneficiaries attributed to that hospital. One thing to note here, though, is if you're trying to compare across facilities, you should use the facility selector within that 9th component, the category selector, as this will kind of allow you to display whatever metric you have set across those facilities rather than limiting the database to just those facilities. And then again, here I'll just plug, if you're only worried about the hospitals that you have access to, I would leverage the Hospital Attributed Sandbox for all of the queries that you're making, if that's what you're interested in. The 8th report component is the metric, and this defines the metrics displayed in the report, a list of all of the metrics and their definition, again, can be found in the MPA user guide. On the next screen, I'll show the options that you have at your disposal, but I won't cover all of the metrics in detail. Again, refer to the user guide if you're curious of what these mean and where they're pulled from the CCLF data set. The 9th and largest kind of report category here is the category selectors. So these allow the user to make 3 selections of categories that will be arrayed from the left-hand side of the report to slice the data. Each of the categories have 2 drop-downs. So the first one being the category filter. This determines the data slicer categories, allow for slicing the data across multiple different dimensions. All of our categories are either beneficiary-based, meaning they relate to attributions of the beneficiary, like age, for example, or claim-based, and these relate to attributes of the claim, like provider specialty. Again, on the next slide, I will show you the available categories that you have at your disposal. The second drop-down related to one category is the category value. These drop-down boxes can be used to limit the values from the category displayed in the report. It's important after you make a category selection that you hit play on the report, as this will render all of the category values that you have at your disposal for that category. Otherwise, when you're in the pause kind of functionality of this report, it will be stuck to whatever category was defaulted previously in the query that you made in this report. Again, all of the category values can be kind of understood and detailed out in our user guide. So I would reference that as using that report. So those are the 9 basic components of the report as I kind of think of them. And then here on the next slide, you can see the available metrics as well as the category fields that you have at your option at your disposal. The 3 that are highlighted in orange there are only available in the next dashboard that I'll talk about, the hospital attributed sandbox, and those are professional provider, dual status, and MDPCP supplemental adjustment affiliated facility. All right, our next dashboard is the hospital attributed sandbox. We've kind of alluded to this one already. It is exactly the same as the all hospital sandbox and functionality, except that additional data is available from those 3 categories, as well as the data that is available to query is limited to the facilities that you have access to and the attributed beneficiaries to those hospitals only. It's important to note here that the rendering facility is still available in both dashboards, but the all hospital sandbox includes only regulated facilities, while the hospital attributed includes unregulated providers, as well as those 3 columns of categories that I mentioned on the prior slide. Next, we move into our MPA monitoring reports. And so these have now only 4 tabs. Again, in the July release, they will have 2 additional tabs for academic medical centers to understand the reward penalty calculator of that additional attribution layer plus the net of the 2. But most folks will just see 4. So this first one is the total cost of care overview by attributed hospital. It includes 3 tables. Each have the same kind of column breakdowns. So you have year-to-date performance comparison of the base year to the current year. Then you have the full year listed out in columns for the base and current year. And then you have the base year and current years broken out by quarter. And here's where I was mentioning the fact that because only January data is available in the report, the year-to-date will be the same as the full year and the quarter available under the performance categories. But as data runs out, you will see the utility of those different columns and be able to understand the difference of them kind of side by side like that. These 3 tables kind of cover metrics on the following. So the first one includes metrics on monthly Medicare paid per capita measures and then percent changes between the base and current year. The second table contains total cost information, and the last table contains total CCF beneficiary information. So that is tab 1A1, or the kind of total cost. And then we move into 1A2, which gives you a base versus performance comparison for all of the hospitals. On this dashboard, you have the ability to change the results to be kind of year to date or a full year for the base period comparison. And then you also have hospital name facility selectors so that you can cut to the hospital that you want to benchmark yourself against, or the ones that you are managing if you're a system. And I think there's really 3 components here on the report. There is that first column on the left, which is giving you a percent total CCLF per capita comparison between the performance and base period. And then you move into the measures that are broken out specifically by base year, followed by those same metrics listed under the performance period. And then lastly, you have your MPA target at the very right side of this dashboard. And then the next tab is 1A3, which is the exact same information and columns and metrics that are available in 1A2, except all of these have been risk adjusted. So you can do the exact same comparison across base and performance year, just with measures risk adjusted. And then our last kind of dashboard that I will kind of walk through today is the Geographic Reward and Penalty tab. And this is a really great one that shows the MPA kind of estimated reward or penalty based off of performance of the hospital with their attributed population. So this tab shows inputs and calculates the estimated MPA reward or penalty for each hospital using the most data available. The source and calculation for all fields in the statewide inputs are listed there at the very top in lettered variables. And then the hospital specific inputs are what's kind of displayed in the number kind of variables that are described in the footer of this report. You can't see it on the screen, but it is a very detailed footer that kind of explains all of the calculations derived so that folks participating at home can follow along and do the math if they want to from the dashboard and really understand exactly where all of these calculations come from. And then lastly, on this report, in the July release, we will include a academic medical center tab as well as a net tab. So you can see the total reward penalty after both attribution domains are considered. All right, next. So that is the basic overview of all of the modules available to you under the MPA performance reports. Most of these notes and documentations that I'll cover, I did speak to while we were looking at the dashboards, but again, I think these are great reference tools if you are using the report for the first time and kind of want a quick guide of what to keep in mind while using them. Like I mentioned, the pause button will be your best friend as it stops the query every time you are making a selection. So if you're doing multiple selections within either sandbox, it's important to keep that in mind and hit pause before you actually leverage the query. And then it's important to select the category you wish to sort the results by in category 1 if you're making multiple category selections. Most of this we covered in the kind of the data sections of this webinar, but I also talked to how to utilize the incurred through and start sliders in the sandboxes, because these really control the data available in the sandbox. While on the next slide, the year dropdown and the time window control what is displayed for the metric that you are querying the report for. And again, there are some interactions detailed out here between the two if you're using the fiscal year, for example, and the quarterly in the time window. So I would keep those in mind and reference them as you're using the sandboxes. And then lastly, I highly recommended the user guide. This can be found on the same kind of landing page where you launch the reports under a question mark icon. And they really give you kind of where these categories and metrics were derived from the CCLF, as well as defining a lot of those categories and metric things that I didn't go into detail on in this webinar. So I'd keep those in mind. Lastly, here I have a kind of quick reference to the tab numbers of the MPA monitoring reports. These were more important when we had many tabs listed out in the MPA monitoring reports, but now with only 4, it's a little bit more easy to manage, but I still included that so you can quickly navigate to the one of interest. Next, here I will cover the 2 additional reports that we have available for hospitals to understand their MPA attributed population. The first thing you really need to understand, though, is how PHI is shared under these reports, and they really can be shared under two scenarios. So if the patient has a treatment relationship established with the hospital through an inpatient admission or an ED visit within the last 36 months of the most available CCLF data, those patients will be included in the MAID and DEX report, as well as any beneficiary who is kind of available for you to access if you have a care coordination agreement with a provider and that provider has a kind of PHI relationship with that patient. Those patients will also be pulled into your report. This second kind of category is related to all of the work that hospitals do to share their care coordination agreements from providers within the MAT tool. I will include a link to that webinar if you're curious of how MAT works, but because of our limited time and focus on the MPA reports, I won't be covering that today. But those are the two scenarios in which a beneficiary PHI information could be shared under these two reports. And the two reports are the MAID and DEX tool. So within MAID, at the very top, you have a selector to kind of change the attribution type of the patients that are shown in the modules. So you can see you have your touch attribution, and you can filter on whether they touched your hospital on an inpatient admission or ED visit. And then you have your MPA attribution selectors. So if a beneficiary has touched your hospital or their PHI sharing is allowed through a care coordination agreement, you can use this filter to see those available to you. Again, this is not a complete listing of your MPA population, but rather the MPA population in which you have the ability to view their PHI under either of those touch or those CCA agreements with specific MPIs or facilities. And then lastly, you can just view the patients whose PHI is available to you under a care coordination agreement. Oops. And then the last report that we have available is not really a report, but rather a application or service that is embedded in the MAID tool itself, called DEX, or our data exporter. And this allows for hospitals, approved users to download the CCLF data files for their facility. We do restrict the number of users that hospitals can have, so I'd recommend, if you're interested in this report, to connect with your CRS point of contact and then reach out to us, and we can have a discussion about your current users and then who you would like to change to, because again, we're restricting it to 2 or 3 users per hospital, as this is, you know, the complete PHI data that you have at your disposal in these tools, kind of exported out into your own environments. And then the files here contain files and data, fields previously available for download via CMS, but we additionally add a couple derived fields that are currently available in MAID, so you now have access to, for example, chronic conditions, dual eligibility, the H-metrics HAM score, as well as beneficiary address on the files and the data fields that you currently are familiar with under the CMS download. Perfect. So this brings us to the end of our presentation today. We do have 9 more minutes if folks have any questions. Again, drop those in the chat box, and I will kind of list out the user guide, as well as the slides, the HCRC Year 5 memo, and the recording of this presentation to participants in the email later this afternoon. So if folks want to leverage the chat box, this is a good time to do so. So Raven asked, is there a report showing the total number of MPA attributed patient, including those we can see data for and who we cannot? So I will scroll back really quickly to here, where you can filter on the facility of interest, and then you can see at the bottom the total CCLF beneficiaries that are attributed to you under the MPA policy. And then using the filters that are in MAID, you could probably tell the amount of geographic bennies that you're able to see at the current time by doing a count of the export that you can get. But we don't specifically call out, hey, you have X amount of MPA geographic beneficiaries in your PHI sharing modules. I hope that answers your question. Give folks a few more minutes to ask questions. But again, if you think of something later, you can always reach out to myself or any of the other team at CRISP that kind of manages our CRS reports. All right, well, seeing no other further questions, I hope folks found this webinar informative, and I appreciate you taking some time out of your busy days to understand the MPA monitoring reports with us. Take care, and I hope you have a great weekend.